Good morning to all. I am Professor Manavalam. Now we are going to see about the immediate newborn care.
Good morning to all.
Good morning, ma'am.
Today, Miss Brinda Devi, final year BSc Nursing student, going to do a case presentation on immediate newborn care. So she is going to explain the immediate newborn care with the case scenario. So Brinda Devi, you will start.
Now we have to briefly see about essential newborn care.
Brinda, first read the case scenario.
First, the given case scenario is Mrs. Divya delivered a male baby at 40 weeks of pregnancy. The mode of delivery is normal vaginal delivery. The baby cried immediately after the delivery. Oral nasal suction done. The birth weight of the baby is 3.2 kg.
So this is the case scenario. Follow that immediately after delivery, they used to do the oronasal suctioning. Then they will maintain the thermoregulation and they may monitor the weight of the baby. So follow that. What are the way they are taking care of the baby, newborn baby, that we will see through PPT.
First, we have to see about what is the meaning of newborn care. Newborn care is a comprehensive strategy designed to improve the health of the newborns through the intervention just soon after birth in postnatal ward and up to 28 days. It is nothing but we have to improve the health of the newborns. Then what are the purposes of immediate newborn care? Early detection of problems and danger signs to help the mother to meet the basic need of the baby, breastfeeding, warmth, prevention of infection, to initiate the breastfeeding within 1 hour of birth, to encourage, educate and mother to give exclusive breastfeeding and care of the baby, to treat the problems such as asphyxia and sepsis. What is asphyxia?
Breathing
difficulty. This breathing difficulty or lack of oxygen in our body. To advise the mother and family members for the continuing care,
Asphyxia means it is not a breathing difficulty. Dyspnea is a breathing difficulty. Asphyxia is just because of lack of oxygenation. The blood baby is developing the respiratory inoxygenation. The baby develops breathlessness.
Immunization and growth of monitoring.
So mainly the purpose of giving a immediate newborn care is to initiate the breastfeeding, to prevent the warmth and preventing the further complication to the baby, and we are encouraging and educating the mother importance of immediate newborn care and immediate breastfeeding to the baby, and teaching about the immunization to the newborn.
Then immediate basic care. First, we have to dry the baby, replace the wet towel, position the baby, establishment of open airway, maintenance of temperature, initiate breastfeeding within an hour of birth, identification of newborn, administer injection vitamin K. First, we have to see about dry the baby and replace the wet towel. First, after the delivery, we have to dry the baby immediately and we have to replace the wet towel to another
warm towel. We have to cover the baby with another new warm towel. Pre-warm towel always we have to have with us.
Then mechanism of heat loss. How the baby is lost the weight. First,
lost the heat of the body.
Heat. First, there are 4 steps in mechanism of heat loss: convection, radiation, evaporation, conduction. Convection means the baby lost the heat by the air in room, and in radiation by cold windows or walls. In evaporation by baby bath. Conduction means by cold hands or stethoscope or instruments.
By touching with the cold hands or stethoscope. This is not a pre-warm stethoscope. Without that we are touching, or we are using any type of instruments to monitor the baby, so that the heat which will be getting lost from the baby.
Then maintenance of temperature. Immediately dry the baby under a radiant warmer, skin to skin contact with mother, cover the neonate with warm towel. The head and the extremities should be covered. The head and extremities should be covered properly and grooming in.
So mummification, you know very well, I think so. We have to mummify the baby completely. We have to tuck the baby inside the warm towel, and we have to develop the rooming. We have to keep the baby near to the mother or kangaroo mother care. If we extremely premature baby means we can start to provide kangaroo mother care.
Establishment of open airway. Majority of babies cry at birth, take spontaneous respiration and immediately suction the secretions, wipe mucus from face, mouth and nose. In this phase, we have to wipe the mucus from the face and mouth and nose. This prevent the airway obstruction. That's why we have to wipe the mucus and secretions. We should done the mucus. We should done the suctioning and to prevent the airway obstruction.
Immediately after the delivery, we have to do the oronasal suctioning to bring out the mucus that is obstructing the airway. So then immediately the baby will start to breathe. Initiation of respiration, it will be start because of birth, or otherwise if the baby is crying immediately, that is the first sign of initiation of respiration.
Then Apgar scoring system. What is Apgar expansion?
Activity, pulse, grimace, appearance, respiration.
These are the points of Apgar scoring system. We have to. The Apgar normal score is total score is 10. Normal score is 7 to 10. Mild is 4 to 6, and severe is 0 to 3.
Apgar scoring, they is to monitor 1 minute and 5 minutes.
Then newborn identification. In newborn identification, we have to provide identical bands and identical bands for the baby and mother. Just use it to easily identify the baby and mother.
In that we have to mention the name baby of who is. Take as example, baby of Mrs. Divya, like that when the delivery has happened, what is the birth weight, like this the things which will be present in the back.
Then vitamin K.
Gender also we have to mention, very good.
Then we should administer the vitamin K injection. It prevents the hemorrhage of the baby. For the term infants, 1 mg for IM. Preterm infants, 0.5 mg in IM. This is the dosage of the infant vitamin K administration. Alternative route is oral dose 2 mg orally at birth. Repeat doses 2 mg at 3 to 5 days and at 4 to 6 weeks of age. Then initiation of breastfeeding. The breastfeeding is started within half an hour of birth. These are the routine care of neonates. First born, breastfeeding, skin care and baby bath, care of umbilical cord, care of eyes, clothing of baby, general care, taking anthropometric measurements. Protection from infection, observation, immunization, follow-up care. These are the immediate newborn care of. These are the immediate newborn care.
So I thought that you people are got some point about the immediate newborn care. So now the question session. So just ask question whether they understood or not. Whatever points you thought to them, bring to them. When we have to start the breastfeeding, initiate the breastfeeding? Within half an hour period of time, we have to initiate the breastfeeding. So according to the mother, condition of the mother and the baby, sometimes the time it may be vary. So sometimes the baby is having certain type of complication, or mother is encountered with some type of complication, means we can give the time period of 2 hours. Up to 2 hours we can wait and start the breastfeeding. The initial breastfeeding of the cholesterol without missing that we have to give to the baby. That is very much essential. Next, apart from that, the baby bath, immediate baby bath, now it is not provided to everyone. They are because in order to maintain the thermoregulation, they are postponing the baby bath. Next, just they are wiping out the things, the blood which was staying over the baby. Then they are covering the baby with warm towel. The next, immediately after the second day only, they are giving the baby bath to the baby. And the immunization also, they immediately they are giving, start to give the the BCG vaccination and oral polio as well as hepatitis vaccination they are giving. And the baby start to on the time of discharge or the second day of delivery, after the baby, birth of the baby, they are giving the immunization. Umbilical cord care and all followed that immediately. They are nothing doing in the any care to the umbilical cord. Just they are checking whether umbilical stump is healthy or not. It has the vessels in it or not. That only they are checking it. Later they will start to give the monitor the stump of the umbilical cord. So this is about the immediate. Of course, core monitoring is very essential, both 1 minute and 5 minutes. So the warmth, providing the warmth, providing the breastfeeding, and monitor the of course scoring. Next, give immediately suctioning. Monitoring the baby weight and length. Thermoregulation.
Monitor the weight of the baby.
Administration of vitamin K. Immunization. Observing it. Close observation of the baby to find out the any minor ailments discomfort the baby is experiencing or not. So that's all about the immediate newborn care. Thank you all.
Thank you.